Hello, everyone. Today we are going to talk about musculoskeletal health. And it is a very important system of our body because generally people think of bone as their musculoskeletal system, but muscles do play a very important role in our body. So let us start. What is the importance of musculoskeletal system in our body? It keeps a very key role in keeping good mobility and along with enhancing the ability to work and actively participate in all aspects of life. So, good musculoskeletal health is also crucial to maintain economic, social, and functional independence across their life course. And it is also important in reducing the risk of other non communicable diseases, and it can only be achieved with adequate musculoskeletal health. Now, what is the relationship between painful musculoskeletal condition and reduced capacity to engage in physical activity? So, impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitation, proceeding in loss of participation and withdrawal from usual social, community, and occupational activities, further decreasing the quality of life and well being, including mental well being. So, it can lead to substantial personal, community, and societal consequences, particularly in older people. So, there is a strong relationship between painful musculoskeletal conditions, lack of physical activity, and resulting functional decline, loss of well-being, and loss of independence, as well as depressive symptoms, has been described by severe epidemiological studies. An individual with arthritis and musculoskeletal disorders sure to be lesser active than an individual without arthritis. Thus, a lack of regular physical activity emerges as the most prevalent risk factor associated with functional decline. Most importantly, impaired musculoskeletal health causing reduced physical capability like grip strength, walking speed, chair rising, standing balance has been frequently linked to increased mortality. Thus, weak musculoskeletal health is a key component of frailty. Now, what is the impact of impaired musculoskeletal health? This impact is now recognized globally with an increase in morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining active reproductive and prolonged working life. With an increase in global retirement age, maintaining good musculoskeletal health will become increasingly important for older workers as many occupations and work-related activities are associated with musculoskeletal disorders like low back ache and shoulder disorders. Thus, it is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive at work. High-income countries observe musculoskeletal condition to be one of the major causes of work loss, early retirement, and early loss of retirement wealth. While developing countries see musculoskeletal conditions to have a major impact on livelihoods. Thus, reduced musculoskeletal health results in reduced productivity and economic loss to society at all the levels. And since musculoskeletal conditions are chronic, painful, associated with disability and social disengagement, frequently causing mental health impairment such as depression and anxiety, as well as other comorbidities. So, physical and mental aspects of quality of life related to health is now known to be greatly impacted in persons with multiple morbidity. Unfortunately, this impact is even greater where there is an associated musculoskeletal condition. So, what is the burden of this musculoskeletal related disease? Non-communicable disease now account for most of the global burden of disease, with musculoskeletal conditions being the leading contributor. So, developed countries well recognize the transition of burden to long-term disabling conditions. However, now low and middle income countries are also demonstrating the enormous future impact from musculoskeletal disorders such as osteoporosis, low back ache. Since age is the commonest risk factor for musculoskeletal condition, it is estimated that by 2050 there will be a 5 times rise in the people over 40 years living in developing countries, contrasting the wealthier countries. Additionally, obesity, another important risk factor for many musculoskeletal conditions, is also hypothesized to rise dramatically in the developing world over the coming 2 decades. Furthermore, increased use of motor vehicles is not only reducing physical activity but also increasing number of motor vehicle accidents and resulting musculoskeletal trauma and disorders. So, what is the role of physical activity and sedentary behavior in musculoskeletal health? Sustained and systemic urbanization in developed countries has led to sedentary behavior among the people, particularly younger ones. The rapid growth of legions of video games, social media, movie streaming, binge watching seems to be the prime contributor. So the surge in sedentary behavior is not only a major factor for many chronic disease, but it is also recognized as a substantial global economic burden. So increasing physical activity and optimizing exercise, such as recommended by Arthritis Research versus Arthritis and World Health Organization is an optimal way to improve musculoskeletal health. Evidence shows the effect of sedentary lifestyle can be reduced by a small amount of activity every day. And a recent meta-analysis utilizing the data of more than 1 million individuals concluded that 1 hour of moderate level activity daily can eliminate the risk of death associated with 8 hours of sitting. Thus, a moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior is a major contributor to obesity and type 2 diabetes. Likewise, obesity is also a major contributor to the development and progression of OA, with severe epidemiological studies confirming the link between adiposity and joint degeneration. Evidence suggests that increasing the level of physical activity not only increase musculoskeletal health, but also decrease the risk of suffering from obesity-related disease, such as diabetes. So what are the WHO recommendations on physical activity for healthy individuals? So it is like nearly 2 hours per week of moderate physical activity for about 20 minutes per day of any kind of physical activity like brisk walking is recommended by WHO. These exercises elevate heart rate and are known to be associated with a lower lifetime risk of cardiovascular disease. Apart from rendering musculoskeletal health benefits, improvement in cardiorespiratory fitness can be achieved by changing sedentary behavior to achieving low intensity physical activity like walking. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries, and it is used as a preventive health measure, now widely investigated with guidelines around the type, frequency, duration of activity being considered. So what is the focus on evidence-based interventions for the musculoskeletal condition that causes the most DALYs? DALYs stand for disability adjusted life years. So low backache and neck pain can be benefited by staying active and exercising regularly. Group exercise program or workplace support can be considered to reduce the incidence of false balance and strength training, home hazard harassment, participation in falls prevention program, and getting involved in activities like gardening, dancing, etc. helps. So osteoarthritis has been shown to be benefited from the activities and exercises that improve muscle and aerobic fitness like walking, swimming, pilates, weight loss. Supports can be rendered if required. And now coming to the next point, what is the association between healthy aging and physical exercise? Aging is inescapable. Everyone has to age, but it can be made easy and healthy with the help of exercise. Exercise renders many benefits to the aging body, including the manifestation of aging, especially the aging phenotype of the elderly. A recent systemic review concluded physical exercise renders a positive impact on muscle mass and function in healthy subjects age 60 and above by improving muscle performance by increasing the ratio of type 1 to type 2 muscle fibers and increasing the cross-sectional area of type 2 muscle fibers. A European Society for Clinical and Economic Aspects of Osteoporosis, Osteoarthritis, and Musculoskeletal Disease task force recommend high protein intake in combination with physical exercise in postmenopausal women at risk of developing a menopause-associated musculoskeletal disease like osteoporosis. Physical musculoskeletal exercise program improves the strength and balance in aging women with osteopenia. Additionally, fragility fracture risk associated with OP can be decreased by following an exercise program. And exercise increases bone intensity and reduces inflammatory markers, as having an active lifestyle from an early age and following recommendations for exercise should be beneficial for women. Furthermore, exercise and mechanical loading also have a positive impact at the molecular, cellular, and tissue level. Like with aging, the potential for cell proliferation and the number of stem progenitor cells decrease in tendons. Exercise loading can induce an increase in tendon collagen synthesis, thus increasing tendon strength. Physical exercise and mechanical loading also have a positive role in maintaining cartilage and bone health. Moderate exercise could also enhance the quality of tissue produced during the healing of injured tendons. So what is the relationship between obesity and musculoskeletal disease? A surge in sedentary behavior and diets have a global impact on obesity epidemic, along with a sharp rise in incidence of type 2 diabetes. These are further great risk factors for cardiovascular and neurodegenerative disease, which further complicates the management of musculoskeletal disease. Obesity is an important comorbidity of many musculoskeletal conditions as it is closely related to the development of OA. One of the commonest musculoskeletal health issues, thus strategies aimed at reducing obesity in adults will reduce the recurrence of OA and thus can alleviate some of the pain of the conditions. Interestingly, obesity is also one of the most modifiable risk factors for OA. Exercise and weight loss also have benefited overweight and obese adults with knee OA in many clinical trials. Thus, combining modest weight loss with moderate exercise can provide the best overall improvement in symptoms of pain and function. So what are the consequences of childhood obesity and physical exercise? Lack of physical exercise in childhood causes childhood obesity, which further leads to musculoskeletal pain in later life. Thus, reducing obesity in children by encouraging physical activity will also reduce the risk of developing musculoskeletal pain later in life. Furthermore, consumption of unhealthy and sedentary lifestyle is contributing to increased incidence of childhood obesity. Low in nutritional value, high in caloric content food further contribute to obesity epidemic, which may also play a role in the high prevalence of type 2 diabetes and cardiovascular disease, which are further exacerbated by a lack of fitness and by activity. Is diet also a part of healthy living? And how does it affect musculoskeletal health? Yes, diet is inevitably an important part of healthy living. A 3-year follow-up study, including about 400, showed that diets in potassium, rich in potassium, from fruits and vegetables, reduce the amount of muscle loss in adults more than 65 years. Dietary flavonoid intake is also known to be positively correlated with good bone health in perimenopausal women. Improving the diet of 4 patients have also shown good benefits. Vitamin D, calcium, particularly protein consumption, have been shown to optimize muscle, bone, and functional outcomes in older people, reducing fall and fractures. Calcium and protein synergistically optimize bone health. Thus, dietary strategies for improving musculoskeletal health should include consumption of long-chain fatty acids, vitamin D and K, and decreasing blood cholesterol. Antioxidant-rich diet may also benefit athletes by improving tissue repair. Sarcopenia in elderly people can be benefited by combining exercise with a dietary supplement or whey protein fortified with vitamin D, as it increases muscle mass and strength. So this is an overall view over the musculoskeletal health, and I hope you will be benefited at least in some sense by listening to this topic. Thank you so much.